And a lot of patients don't realize that just with diet, exercise, quitting smoking, mild ED can be cured. And that really should be the first line of treatment. So hi, I'm Dr. Roger Khouri. I grew up in Miami, Florida. I'm fluent in Spanish. I went to college at Wake Forest University in North Carolina and medical school at the University of Michigan. I'm now a reconstructive urologist and men's health specialist for Northwell Health, based out of Hauppauge and Bayshore. Erectile dysfunction is very common. The sort of rule of thumb is about 50% of men over the age of 50, 60% of men over the age of 60. Erectile dysfunction can be very embarrassing. It's not something that men talk about with each other, and many people don't know how common it is, and many people don't know that there are treatment options outside of the usual medications. A lot of erectile dysfunction is a medical problem that's affected by diabetes, high blood pressure, smoking, lack of exercise, obesity, and just management of these sorts of things can have a very large impact on the erections, and they may not need to have more aggressive treatments if they can sort of optimize all of these factors. About half of the patients that we end up treating surgically, the cause is some sort of previous treatment that they've had for usually prostate cancer that has caused this. In the other half of cases, it's some combination usually of medical factors like diabetes, vascular disease, and that sort of thing. So when a patient comes in, the first visit is an extended visit, usually at least 40 minutes, so that we can really focus on education and also understanding where the patient is coming from in terms of their other medical problems. The other factor to consider is there's a large psychological component to erectile dysfunction. So I always get to know patients where they are in their relationships to see if there's any issues there that are worth addressing.